Hi, welcome back on to Health Issues now here on the Globe. You're watching SABC News Channel, independent and impartial. I'm Tsepiso Umakwetla. South Africa has recorded 3,785 new coronavirus cases. This brings the total number of active cases to 40,186. The health department says 2 more people have succumbed to the disease in the last 24 to 48 hours reporting cycle. This brings the total number of recorded COVID-19 related deaths to 100,377 people. The department says 21,518 tests have been conducted in the last 24 hours. It says the new cases represent a 17.6% positivity rate. Meanwhile, the National Institute for Communicable Diseases has detected a new BA.4 subvariant of Omicron in wastewater plants in 6 provinces. According to the NICD surveillance report, new increases in the levels of SARS-CoV-2 have been observed in wastewater treatment plants in Gauteng, KwaZulu-Natal, the Free State, Western Cape, Northern Cape and the Northwest provinces. COVID-19 variants can be identified in wastewater plants through detection of single nucleoid polymorphisms that are specific to each variant. All right, and to talk a little bit more about this, we're joined now by NICD Executive Director, Professor Adrian Puren. A very good evening to you, Professor Puren. Thank you so much for speaking to us. I just read a whole lot of scientific jargon that I myself am trying to grasp. So let's just first start with, when we're talking about this new variant or sublineages and what we know to be Omicron, what are the differences?
Yeah, so just to be clear, the Omicron variant is still the dominant variant, following on the 4th resurgence. So we are already approaching, I guess, if you want to call it the 5th resurgence in terms of the numbers. So the wastewater, in terms of of measuring the virus in that particular setting, is really a key indicator as well to give us an idea of ongoing community transmission, and in fact it can certainly also aid our approaches to preventing further transmission. So what actually happens is that the wastewater from treatment plants is collected, concentrated, and then we look, as you said, we look for the molecular material specifically for COVID-19. And what has been observed there is the Omicron, and specifically the sublineage called BA.4. Also, quite interestingly, when you look at the genetic material from patients who present, we're not only detecting the sublineage BA.4, but also BA.5. So this is quite key in terms of integrating our data sources to tell us what's actually happening and the association with what we are currently seeing, and that is really a resurgence in the numbers currently.
And Professor Puren, I remember scientists were very hard-pressed at the beginning when the emergence of COVID-19 variants came to the fore to explain to us that we need to understand what a variant is. So I also want to take it back to that conversation. When we talk about 2 new sublineages that have been identified, what are we talking about? Are they, these sublineages, are they variants? And, why is this distinction important for scientists?
Yeah, so I think initially when the pandemic broke out, in fact, there was not really a great interest in terms of what was in circulation around the genetic material, but it certainly has subsequently proved to be very important. So we certainly what we do molecular sequencing. We look at what makes up the genetic material, and specifically looking at specific parts of the genetic material that informs around what we call the spike protein. And the spike protein is very important for its binding to what we call receptors. So changes in the so-called spike protein is very critical because of the immune responses, and of course vaccine development is really critical there in terms of to keep up with what's actually changing. And what we've seen over the last 2 years are these independent variants that have arisen that have led to escape mutations, have led to high transmissibility, and of course has led to severe disease outcomes. or the opposite in the case of Omicron. And they're very distinct, they're very different from each other, these particular variants of concern that have risen, but we also know that there are other variations of the virus in circulation that have no real major effect in terms of immune responses and so forth. But it's the key ones that have led, or the key changes, for example, in the spike protein, that have led to these very different outbreaks or resurgences that we've actually observed. In the case of Omicron, it's actually very interesting to see that although Omicron has remained the dominant variant, within that Omicron variant are variations or subtle mutations that have occurred within the actual virus itself that have led to changes that have led to, for example, increased transmissibility likely, and also likely to lead to immune evasion. And that's why we are currently, although we saw BA.1, BA.2 in circulation, we're now seeing the variant B.4 and BA.5 in circulation. So these are really important because they tell us around what will likely happen. And it's likely that we will continue to see, as we did with the first Omicron resurgence, is that a marked increase in cases, which you're currently observing, but as you noted from your report, that there are no marked increases in hospitalizations and death. Of course, these are lag indicators, but it's likely that this may well continue, that the uncoupling that we've seen in the fourth resurgence will remain in this particular resurgence.
I understand that the Africa Research Institute laboratory tested blood samples of 24 people that they had been infected with the original Omicron variant but hadn't been vaccinated. And I want to understand what difference this makes. And, you know, I want to also understand the danger of transmissibility, whether it's immaterial, because you spoke about evasion, you know, antibodies from earlier infection or vaccination.
Yes, so that's a very important point that you've picked up. Admittedly, the numbers are small, but I think the initial indications are that in individuals that have not been vaccinated, but have, for example, prior exposure, that the antibody responses are actually reduced, and they're reduced by, I think, 7-fold. Whereas individuals that have been exposed to the BA.1, for example, variant, and now exposed to, and then exposed to the BA.4, that the decline of the response is about 3-fold. So you can see that being vaccinated certainly provides you, it may not protect you against becoming infected, but it provides you a greater degree of protection versus an individual that is unvaccinated. And it's likely that those individuals will have even better protection with regard to the prevention of severe disease. So I think that's the key message that one can take away, that in fact vaccination is still a really critical and important part of prevention of infection. It may not necessarily prevent it, you may have a milder course of disease, but I think more critically, that's what we currently have seen in the previous resurgence and this likely resurgence, is that it will protect you against severe disease.
I want to understand now the issue of mutation and either the source or where the disease itself thrives. I mean, in the beginning, there were concerns around it being found on surfaces that you can catch it from surfaces, frozen food. But I think at some point scientists said, no, it's not only inanimate objects that you can't get transmission from that, but where does the disease thrive? And we're going towards winter. In the beginning, there was this concern about climatic changes and how this could spur on greater levels of infection. Even though Omicron seems to be less deadly, if I could use that term, should we still be concerned about the change in weather and the sources from where it's found or where it grows?
Yes, so those are very important questions. So again, the transmission is primarily through aerosolization of the virus. In other words, through the sneezing and coughing, for example, very marked exhalation, for example, that these fine droplets can then spread through. The droplets may be of different sizes and therefore affect the distances. And so again, I think it's really clear that in terms of protection, ventilation is really critical, especially indoors, and mask wearing certainly serves a particular purpose. It may not be fully protective if it's not the best of the masks that you're wearing, but certainly provides some level of protection. So once the virus has entered a particular set of cells, for example, it undergoes what is called replication. In other words, it reproduces itself. And the enzymes that are involved in this replication process, or the recreation of the next series of viruses, certainly does have some ability, compared to other viruses, have some degree of proofreading ability, but not always. And therefore, these mutations do arise. For COVID-19, it's thought that these mutation rates are fairly slow, but we've seen the exact opposite. We've seen very dramatic changes with regard to the mutations that we've certainly observed. The effect of those mutations is that when you look at the spike protein in particular, that the actual amino acid sequence, which is forms the protein, has changed. And therefore, if those changes are such that, even though you've had an immune response, it may not recognize those particular changes, and that is what we call immune evasion. And some of the changes that we have on the protein itself leads to a different way in which it interacts with the cells, and therefore the rates of transmission will certainly change. It's those combinations of increased transmissibility and immune evasion, and that's how we get these waves coming along.
Just a quick and final one, Professor. Does this mean that we may be forced to create another vaccine for these new variants or sublineages? Because I understand with the original Omicron variant, it showed that the Pfizer shot was less effective. And I ask this because I also want to understand there has been in India a subvariant Omicron XE that was found there. So how do we understand from country to country? Is it a regional thing? What you're in danger of and what you're inoculated against?
Yeah, so there are two things. I want to come back to your previous question and answer your current question. So when we look at Omicron, it certainly behaved very differently to what we expected. So in fact, we had less severe disease, and that was remarkable. But I think we need to not be complacent, because the next variant that could arise could behave very differently, behave something similar to Delta. So coming back to your point about vaccines, can we simply continue to give boosters? That may not be practical. Similarly, your point about having vaccines directed against variants may not necessarily work. And so I think there's a great deal of focus on next generation vaccines, and one thought is to try and create what is called a universal COVID-19 vaccine that will be such that it will protect against whatever variant arises. It may not be easy to do that, but certainly the attempts will certainly be made to try and have a vaccine that will cover as many variations as possible, and that you then have perhaps an annual or two annual yearly updates of your particular vaccine. So that may be one approach. And different approaches such as aerosolization of vaccines, which has been done for flu, for example. So you can really target the nasal membranes in order, for example, to prevent actual infection in and of itself, which has been the challenge around the current vaccines, in that it does not prevent infection, but certainly can prevent severe disease. So I think there are going to be different approaches currently and updates of what we are currently seeing. But I think the current vaccines are working well, in the sense that certainly we are having infections. So I think we just need to accept that we're going to have infections. I know that some of them are not very pleasant to have, but at least I think the sense is that these current vaccines will also then protect us against severe disease.
Professor Puren, thank you so much for your time. Much obliged to you. The National Institute of Communicable Diseases Executive Director, Professor Adrian Puren, just giving us the latest information about the new Omicron variant or sublineages that have been found, BA.4 and BA.5.